Did you need to introduce me from here on, or you want me to just start off?
Yeah, I'll introduce you.
Okay, cool.
Okay, and we should be live. Okay. Hey, everyone. Welcome back. For those of you tuning in for the first time, my name is John, and I'm part of the Dental Shadowers team. I'll be moderating today's presentation. We have an exciting presentation with Dr. Zambrano, an oral maxillofacial surgeon. And just before we begin, Dr. Zambrano, on behalf of our team and all of today's attendees, we'd just like to thank you for taking the time to share some of your professional insight with us. And just on that note, feel free to take it away whenever you're ready.
Thank you very much. Good evening, everyone. Like John mentioned, I am an oral maxillofacial surgeon. I practice here in Cordova, Tennessee, which is a suburb of Memphis, Tennessee. So I'm pretty much in the middle of the country. As you can see on the slide, I'm a diplomat of the American Board of Oral Maxillofacial Surgery, and I'll explain to you what that is as the presentation goes on. Let's go to our first slide. Well, before I move on, I'm going to try to give you a little bit about educational background, the professional scope of oral maxillofacial surgery, and I'll discuss a little bit of the things that you can do kind of like on the side, just from having the credentials as you know, being an oral maxillofacial surgeon, okay? All right. So basically the first and most important thing involved with this profession is education, okay? Pretty much got to go to college or university. You know, dental school, the requirement to get in dental school, when I was going through school some years ago, you actually did not have to have a dental degree. It's highly encouraged, but you didn't have to have a dental degree. Most schools do want the high GPAs and the high admissions test scores, or the good admission test scores. But once you go to college, you want to get into dental school. There are a few medical schools. I don't know if you guys are aware. There are a few medical schools that will match you into oral and maxillofacial surgery. I believe UAB, University of Alabama, Birmingham, is one of them. The other one, I forgot. I believe it's a school in California. But those are things that you always have to look up on websites to see what the latest information is to admission to the residency program and the schools. Okay. Following dental school or medical school, you have the OMFS residency postgrad training. Typically, the programs are separated into two types of programs. You have a school-based oral surgery program, which are the ones that are, you'll see the clinics inside of a dental school. And then you have the hospital-based programs where you have the program is based out of a large medical center. And out of these programs, you'll have 4 and 6 year programs. 4-year program being that you obtain a dental doctorate and then you go and do the OMFS residency program in 4 years. Some of them actually have a medical school component. The last I checked, when I was going through the residency, it was about 50% of them, or 40 to 50% of them were MD-based, MD integrated programs. There's some pros and cons to doing those programs that we can answer as the presentation goes on. But the main thing with these programs are, time, and medical school, you usually have to pay for it. It'd be nice if they pay for the medical school, but they don't pay for it. You have to pay that, okay? And then after residency training program, you could do a fellowship. Probably, I would say about 15% of the guys that are oral maxillofacial surgeons, the guys and gals, they do a fellowship program. It's usually in the scope of TMJ, cosmetics. My old residency director, she did a fellowship program in orthodontic surgery. So if you want further training, you can actually do that. most of those people end up being, oh, I'm sorry, and a big one is oncology, head and neck oncology. Most of those individuals that do fellowship training end up being at a medical center or end up working in a large group, okay? Just because it's a referral, just the specialty in whole is a referral-based specialty. In other words, we're doctors that rely a lot on other doctors to send us patients. Oral maxillofacial surgeons don't really market that much directly to the public because what we do is so specialized. You know, people don't even know, you know, I would say 80% of the people that walk in the door of my clinic, they don't even know they needed an oral surgeon until they went to go see, you know, a nurse practitioner, a dentist, an emergency room, that type of thing. You know, they'll see a doctor and the doctor says, oh, you need an oral surgeon. Board certification falls under education. It's a status that you reach after you pass an exam. I'll talk a little bit about that. But basically what it is you do all the training, you know, you go through dental school, you go through medical school, you go through oral surgery residency training, and in fellowship training. But it's good to have something that says, okay, I'm certified, I actually know this information in and out. You know, I've been tested on it, you know, extensively. I've studied the whole specialty. I know, you know, 95% of what it is to know, at least the surface of it, okay? Because the reason I say that is you can never really know everything. It's a science, it's continuously developing. You never could truly know everything, but board certification lets the public know that you attained a certain level of knowledge in your specialty. And it's very good. It actually helps you with insurance coverages too. It definitely helps you when you're looking for a job. And it definitely helps you if something negative happens with a patient, and God forbid you lose a patient, or the outcome of a case is not the ideal outcome. People will question you. Well, doctor, why did you do this? Why did you do that? Why did you do this? They actually question you a little bit less if you're board certified. You know, it's a very good a thing to have. I'll put a couple of websites on here, aaoms.org, which is this is the website that most of the doctors go to for information. There's literature there. There's a journal that we read and that we follow with all the latest scientific data. And then there's the ABOMS, which is the American Board of Oral Maxillofacial Surgery, which has more information on the board certification process and, you know, what it takes to become board certified. My education, University of Louisiana Lafayette. I got my degree in biology. I did 3.5 years of undergrad, and I took the DAT and got accepted into LSU Health and Sciences. When I got my doctorate at LSU, that's when I was awarded my bachelor's degree from University of Louisiana Lafayette. So I did the step where I didn't even graduate from college and I got in dental school. I had a high GPA, I had a high DAT score, so I was able to achieve that. From LSU, I got my doctorate. I graduated number 9 in my class out of 63 students. Now I matched at the OMFS residency program in Nashville, Tennessee. It's called Meharry Medical College. Nashville General Hospital is the main hospital I worked out of, but our program was a rather small program, so we had different hospitals that we worked out of. We worked out of Vanderbilt Children's Hospital. That's where I did my anesthesia training on kids, infants and children, toddlers, teenagers. I also trained at the VA Medical Center. This is where I worked on older, sicker patients, you know, people that had multiple heart attacks, strokes, really sick, out of shape diabetics, things like that. And then I did my head and neck cancer training and trauma over at UT Health and Sciences in Knoxville. So I got a pretty good roundabout education in the residency program. When you look at a residency program, the residency program's all over the place. And what I mean by that is that there's some residency programs that are in huge medical centers. I'm talking about huge medical centers. You know, the program in Atlanta, there's some programs in Atlanta, there's a program in Dallas, Parkland, LSU's program down in New Orleans, even though it's changed a little bit over the years because of the politics of the city of New Orleans. But the programs all over the country that you know, it's a wide scope of training to be afforded. Now they also have smaller programs that focus on, you know, little aspects of the specialty, and maybe deficient in other areas. So when you look at these programs, you just got to really look at the scope of what they really want to teach you. The other thing too that is really, really good to look at when you're looking at education, if there's a particular program that you really like in oral surgery, try to meet 2 or 3 surgeons that attended that program. Get their feedback, you know, see what their successes are, see what their failures are, see what is it that they liked, they didn't like, et cetera, because every program is different. You know, back when I was going to school, they used to have that saying that the best program is the one you get into. I'm sure it's still like that. But you really want to, once you focus in on a few programs, let's say there's 7 or 8 programs you really like, and you really, you know, thinking about going there, try to reach out to at least 1 or 2 surgeons that went to that program. That's always helpful. Fellowship training, I don't have fellowship training. I considered it, but I really got a really solid residency program training, and I felt like, well, I wasn't really, none of the fellowship training programs really stood out for me. You know, I didn't want to do head and neck oncology all day. Head and neck oncology is totally different than dental alveolar surgery, outpatient oral surgery. You know, so it was kind of swaying me too far away from the basics of oral surgery. Same thing with orthodontic surgery. I got really good training. I didn't feel like I needed any fellowship training in that area. In cosmetics, I did some cosmetics, but it never really, you know, pushed me to the point where I felt like I needed to be a cosmetic facial surgeon. Board certification, I got my diplomat status in 2016, I believe I got it. Last 10 years, so I know mine is due December of 2026. So I am board certified by the American Board of Oral and Maxillofacial Surgeons. Again, those are the websites. You're going to look at more information on those. Scope of the practice, what you can do once you become an oral and maxillofacial surgeon. Academics is always going to be available. Those jobs are going to always be available. And when I say academics, pretty much due to scope, you're going to be teaching oral surgery residents. In other words, you'll be doing a little bit of cosmetics, you'll be doing a little bit of dental implants, you'll do extractions, you do anesthesia, you do trauma. Because if you're going to be a teacher, you have to teach everything, you know. Now, the good news is that in an academic center, an academic setting, typically you got 3 or 4 attendings. You know, you may get lucky, you may have 8 or 10 attendings, or even 12. Well, the whole idea of academics is that if you want to learn how to do implants really good, there'll be 2 or 3 doctors that are really, really good at it, and they'll teach you. They'll teach, you know, they'll tell you where to get the material from, where to get the books from. You'll review literature with them, you know, research papers and things like that. And that's how you learn over the years. You know, you spend 2 or 3 months with this guy or this gal, you learn this information really well. You regurgitate it, you present on it, you look at their presentations, et cetera, et cetera. And that's what academics is about, you know. Prior practice is what I do right now. Basically, you graduate from the program. I was in attending for a while. I was in academics for a while. I did academics for about 1.5 years to almost 2 years. Then I went into private practice. And basically, private practice is when you open up your own office, you know, or you go get a job at an office, you know. I opened up my own office. I actually started working for a group of dentists. I stayed with them about 1 year. Okay, I saved up some money. I got some things lined up with a bank, to get a loan, and I opened up my own practice. Okay. Within the practice, a lot of surgery of the teeth, you know, tissues. We typically call that dental alveolar surgery. Facial surgery, you can do facial surgery if you want as an oral surgeon. Cosmetic, you can do cosmetic stuff. lot of trauma, pathology, orthodontic surgery, surgery of the jaws and move the jaws around. You work in conjunction with some orthodontists, TMJ surgery. I mentioned pathology before, but you have lesions that are benign versus malignant tumors. Once benign tumors, I do benign right now. But once if you want to start operating on malignant tumors, a suggestion is made that you should do some fellowship training. Because those patients the treatment is so involved when it comes down to malignancy and cancer that you really don't have time to do anything else. Cancer surgeries can last anywhere from 4 to 5 hours, even up to 12 to 14 hours. Because the thing about a cancer surgery is you have to not only remove all the cancer, you have to dissect down into the neck, and then you have to reconstruct. That's what makes it so long. Removal of the cancer itself may be 4 or 5 hours, but the reconstruction may be another 4 or 5 hours. So you can just imagine, you're not going to do these long, very meticulous surgeries and then wake up the next day and go pull a couple of teeth in your office. It's just too broad of a scope. So we usually ask our oral maxillofacial surgeons that are operating on malignancies, do fellowship training and just do that. Be a head and neck oncology surgeon. Then another big thing that's always up in the air with us, and it's always in the news and it's always being discussed, is anesthesia. One of the best kept secrets of oral surgery. People in dental know about it, and some of the medical, some of the medical field knows about it. But one of the biggest beauties of oral surgery is you get general anesthesia training. The reason you get the general anesthesia training is because many of these procedures that we can do outpatient. But it's just cost effective to be able to provide the anesthesia to a patient. You're going to do a surgery that only lasts a half an hour, or 45 minutes or an hour, or at the most 2 hours. Typically, I don't like to sedate patients or put them on the general for more than 3 hours. But sometimes I do. When I do big implant cases, I have the patient on the general anesthesia for 2.5 hours. But if I were to go out and hire an anesthesiologist to provide that service for me, for one, they have to come to the office. That increases the liability. The other thing is I have to pay them. Anesthesiologists are not cheap. Just like oral surgeons are not cheap. They're going to charge you. So it's a lot more cost effective if I'm doing a surgery and I'll say, I'm doing this surgery for you. I'm also doing your anesthesia, but I'm only going to charge you this much instead of this much. Now, keep in mind, all of these surgeries add up too. So even if you're just charging a little bit, but you're doing it every day, 4 and 5 times a day, at the end of the day, you get a nice bit of money from the anesthesia costs. So that's one of the beauties of oral surgery. It's like a gem that we have within the profession. But you actually make money off the anesthesia too. Common procedures. My most common procedure that I do in the office is third molar surgery. I don't know if you guys have had your third molars out, but about 85% of the population needs them out. Many people cannot tolerate that pain once it kicks in. We as oral surgeons, we prefer to take them out when you're a teenager because the procedure is a whole lot easier, recovery is a whole lot quicker, and the surgery is just so much safer. Many younger people don't get sick off of anesthesia. It's safe. We can do it a little bit faster, the surgery. The healing period is quicker. Those are all things that you'll learn in the future, but that's probably the most common procedure on an outpatient basis is what I do. We also take out extractions, the other teeth besides the third molars, and we put bone grafts in there to prepare the site for future dental implants. We do a lot of dental implants. Earlier outpatient IV sedation and local anesthesia. Mandible and facial fractures repair. I had a facial fracture today. Pathology and cysts and tumor removal. I do a lot of that. So just keep in mind that the cysts and the tumors that I'm removing are benign lesions. Okay. Every once in a while, I'll take out a cyst or a tumor and I send it to the pathologist to look at it. for a biopsy, and it'll come back and say, Dr. Zambrano, it's actually a cancer. When I get that report, I typically will send that to the medical center, to the colleagues over there that treat, the fellowship trained guys that treat just cancers. And pre-prosthetic surgery. Pre-prosthetic surgery basically is when we remove the teeth. Sometimes people's bones are not correct to accommodate a denture. So we'll actually trim all the bone and remove all the infection that's located within the bones. And that helps us, prepare this patient, like I said, for a future prosthesis. If we have time, we can go, how are we looking on time?
We're looking great. If you'd like to switch over to the website that you were planning on sharing.
For a few and make sure we don't get lost here. Let's see where we're at. I thought I had it up. Here it goes. You see the website there?
No, I think you actually have to share that screen.
Okay, let me.
So go ahead and try backing out and then try and sharing that particular screen.
Okay. All right, so let's see. Can you see where it says Safari at the bottom? Or is that
No, go ahead, scroll down to the bottom.
Okay.
Stop sharing your screen, your current screen.
Stop sharing that one. Okay.
And then click the share screen button once more, and then share the screen of your desktop or.
I got it. Okay. Share. All right. So that should pop up now.
There we go. Great.
All right. So that's basic. So this is a very good summary, okay, of the profession right here. If you can see, there's a tab here, what we do. I'm not going to click on all of these. This is something informative you guys to do on your own time. But what we do, why choose an OMS. There are multiple videos here, okay? And these videos will show, they don't show an all-out surgery, but it talks about patients' experiences that have had these different procedures, okay? So this is very good. If you want to talk about, or if you want to read about corrective jaw surgery, wisdom teeth management, oral head and neck pathology, TMJ and facial plane. We didn't talk much about cleft lip and palate. That's another one that you would want to do fellowship training in, but you can definitely do it. Okay.
Right. So is this just like an informational resource for students and patients?
It's mainly for patients, but I direct students to it a lot because laid out is so nice. It talks about the research that goes on with oral surgery. There are videos. It just gives you like a little foundation of what's going on in the profession. Because quite frankly, a lot of patients come to us and they don't really get it. They don't really understand, okay, well, why is my dentist sending me to you, another dentist, to do a procedure?
Right. So, there's an informational gap or an informational barrier.
Exactly. And I'm gonna be honest with you, I'll make you laugh. Until I started looking at a profession in college, I had never even heard of an oral surgeon because I never needed one. So,
right.
So I kind of, when people say, well, I don't know why I got to go to an oral surgeon. I giggle a little bit because I say, you know what? That was me 20 years ago. I'm like, if you'd have told me to go to an oral surgeon, I'm like, for what? What do I need to go to an oral surgeon for? So this website, what it does is when we talk to, let's say if I talk to a patient or a parent of a patient, and I say, your daughter needs corrective jaw surgery. And we'll start talking about it and they'll be kind of lost a little bit. I'll say, go to this website and click on corrective jaw surgery. And then they'll look at a video. And they'll look at this video and say, whoa, this little girl looks a little bit like my girl. Looks a little bit like my daughter. And then it'll have, these bullets. You see the bullet list right here. And they'll say, okay, those are reasons why they would do these surgeries. You know, birth defects, facial injuries, receding lower jaw and chin, protruding jaw, things like that. And then they'll have cases, you know, to look at.
Yeah, it seems like an amazing resource for the purposes of transparency between providers and patients.
It is. You know, multiple reasons why I send patients here too. I have, let's say if I see a patient, you know, in my office and she goes off to Texas A&M to go to college. I seen her when she was a junior in high school. Now she's 3 years into college. Uh-oh. So my internet connection was unstable. But let's say the little girl is 2 or 3 years into college and something happens. She breaks a tooth and she needs a dental implant. Well, I would tell the mother, you know, why don't you go to the website, find a couple of surgeons, find out if they're board certified, and send me the names, and I'll kind of research them for you, and I'll recommend someone to go to. That's the beauty of this website. You know, there's a lot of just a lot of information, but it's not in scientific terms. In other words, someone can kind of read this and follow along and understand what's going on. But I send students to it all the time because, you know, if a student asks me, well, what does oral surgery do? I'm like, well, the answer's right here. This is what we do. All of these procedures right here. You know, why do people choose OMSs? Like I said, videos, news, there's news here, things that are happening in the field, research. They started a new initiative. They want us to do research in private practice. I don't know if it's because it's cost effective or what the reason is, but, you know, and then you have contact. You can even reach out to people that work for AAOMS, okay? So this is a really good resource for you guys to look at. Like I said, I always tell patients about it. I always tell students about it. And every once in a while, I even go to the website, okay? So we'll move on here. Let me see if I can get it to go again. All right. All right, so we're back, right? Can you hear me?
Yeah, we're looking good.
Perfect. So myoms.org has a nice summary of our scope. Board certification, I talked a little bit about it before. You know, when you're going through school, when you're going through dental school, when you're going through medical school, when you're going through the oral surgery program, in my eyes, and it is my opinion, there's many professionals' opinions, they're highly ranked members of oral surgery or in the profession. A lot of the people that write the textbooks, this is the ultimate goal right here, oral certification. To me, it makes no sense to go to school all those years and not have a piece of paper saying that I am 110% legit. You know, it's kind of like a financial planner. You know, they get those certificates to become a certified financial planner. You know, it's just, you know, it's like having a license to drive. You know what I mean? You may be able to drive, but if you can't pass the license test, okay, I don't know if you're going to be trusted. But basically, the website is aboms.org. It consists of an extensive written and oral exam you take after residency program, okay? So written exam certifies you for, so the written exam certifies you and you have to pass it to be able to take the oral exam, okay? The oral exam is an all-day event. You fly to a certain city. I had to fly to Dallas to take it. Once you pass the exam, certificate is active for about 10 years, okay? There are yearly dues, you know. But the thing about board certification is actually not mandatory. So I had this discussion when I think I was a first or second year resident. And one of the upper level residents, this topic came up and I basically told him, I said, well, you know, my goal is to become board certified. As soon as I'm eligible for the exam, I'm taking it. And this guy, he wasn't from the United States of America. He was, I think he was planning on going back to another country. But he told me the exam wasn't important. And I said, and I basically started arguing with him. I said, well, the exam is important because, you know, these reasons. All the guys that were mentors to me, all harped that I need to be board certified. So in my eyes and in my vision, the way my thought process was, I have to become board certified. So I had that discussion with him. And, we just left it at that. We just didn't agree on that. Years went on. We got out of residency program. I got my boards, and I got a phone call from this resident that was a few years ahead of me. I think I was like 2 years out of residency now. And he says, "Man, I never went back to the country where he's from." He's like, "I'm actually practicing here, but I'm having a tough time at the hospitals. They won't let me operate on people because I'm not board certified." And I said, "Yeah." I said, "Remember that discussion we had? And I told you that you need to be board certified." So he couldn't he got hospital privileges, but they gave him like 2 years to pass his boards. So his time had elapsed, his time had ran out. The other thing that he was having a problem with was insurance reimbursement. So insurance is reimbursed better if you're board certified. There's a multiple reasons why you want your boards, but another thing is really no literature behind this that I know of, but people tend to second guess you less when you tell them you're board certified, because there are going to be patients that are going to be skeptical of treatment. They're going to be like, "Well, you're saying I have a tumor, but do I need to remove it?" There's people that actually argue things like that. They'll say, "Well, I have a tumor right here. It's growing on my face, but it doesn't hurt, doesn't bother me. Why do I need to remove it?" It's good to give them a scientific reason why you need to have it removed or why you don't need to have it removed. Part of the board certification training, when you take these exams, it kind of teaches you how to present these situations in a more formal way, in a correct way, to you, the way you work them up. It's a very interesting thing, this board certification that we deal with, okay? So always keep that in mind when you're going throughout your studies, that, I just feel like the goal, no matter what you get into, whether it be, endodontics, general dentistry, prosthodontics, whatever you decide to do, it's always good to have one of the highest certificates you can get in that respective field. Salary. So salary ranges in this profession. Okay, it really depends on what you're doing. Academics, you can expect a salary of about 150 to 400K. Are there some people in academics that make 400K? Yes. I don't know how many. Every medical center is different. The other thing that is very important is how the medical center is set up in academics. There's some medical centers that have what they call private practice within the hospital or within the clinics. There's some that don't. There's some that just the school pays you. There's some that are federally, paid by federal government. You have private schools. So it's a wide range, is what I'm saying. But on average, I would say it's probably between 150 to 400. Private practice, there's also a wide range there, because private practice, you're really at the mercy of what your hands can do. I've been around a lot of fabulous oral surgeons, really good oral surgeons. Some of them work faster than others. Some of them work in areas that are more affluent than others. Some of them like certain procedures. So all that equals to is that a private practice owner, okay? So you have an owner, the salary is going to just vary a big deal. Now, there's some guys out there or girls that love to golf. They love to play tennis. They love to travel. They may not even work 5 days a week, 6 days a week. They only work 3 days a week. Well, if you work 3 days a week, you're going to probably make less money than someone who works 5 days a week. So it's just common sense, just on pretty much any job situation. Associate surgeon, the associate surgeon is the guy or girl that works for the owner of a private practice. Okay. They tend to make a little bit less. They have a little bit less stress on their shoulders too, because they don't have to worry about, paying the mortgage or the rent on a building. They basically go to work, they see their patients, they do their procedures, and they go home. But they do very well. They probably make between 275 to 500K a year. Again, they're at the mercy of their skill set. How fast can they place an implant? How fast can they remove a wisdom tooth? how fast can they fix a mandible fracture, you know? And then you got a partner surgeon, which is, imagine the owner of a private practice, but he sells part of the practice, and now he has a partner. That the partner usually tends to make a better salary than an associate surgeon, but they have more responsibility. Okay, they're more on their shoulders. They're more in tune on the administrative side of things to make sure that the practice is flowing correctly, make sure that the marketing is being done, things like that. And then you can also combine it. You can do academics and private practice. So the salaries would be somewhere in between all those numbers above. But no matter what you do, like I put in that last bullet there, you're not gonna miss too many meals as an oral surgeon, okay? I don't know one oral surgeon that complains about financial problems or things like that. Well, I actually do. You can mismanage money, but it's not like you don't make income. But there's plenty of guys that I've met and girls, they just mismanage money. So that's a different thing though. Mismanagement of money has nothing to do with great salary potential, okay? Let's see what else we got here. Adjuncts to the profession. In other words, things you can kind of do outside of what we just mentioned. Consulting. You can always get a job as a consultant. You can start your own consulting business on the side. If you want to consult, after you've been an oral surgeon 10, 15, 20 years, you can consult the guys that are just coming out and they want to learn, want to take some shortcuts and learn some stuff quickly. Expert witness. I do a little bit of that. From time to time, I do have attorneys that call me. And they'll say, would you mind being an expert witness on an oral surgery lawsuit? And, I charge a pretty penny for that. And I'm doing one right now. I might get 200 sheets of a chart or a certain case and we do depositions and things like that and give my expert opinion on topics, okay? Teaching, we kind of talked a little bit about that, but teaching in this sense is a little bit different. This is teaching like privately, like you can teach, you're an oral surgeon, but let's say you want to teach a group of dentists how to do implants, or you want to teach a group of dentists how to take out a wisdom tooth, or you want to teach about anesthesia meds that, things like that. It's kind of like this private teaching that you can do, and people make money with that. They charge, they charge fees for that. And lastly, sales. You can actually work for companies that sell products to oral surgeons. So an example of that would be, let's say if I use a certain type of X-ray machine, and I work as a consultant or / salesman for a company that sells the same X-ray machine. Well, I'm gonna be an expert at that X-ray machine. I use it all the time, and that company can hire me, call other oral surgeons to try to sell them the machine. So you can actually make money like that on the side. So these are just a little bit of the few adjuncts to the profession that you can do if you have, your credentials lined up. And so forth. There's probably a few other things I didn't mention there, but those are things that you'll learn in time, okay? But those are adjuncts to the profession. Let's see where we at here. And that's about it.
Perfect. We have quite a bit of time. So if Issa would like to tune in and take it away from here,
you
can touch on some of the questions in the chat.
Thank you so much once again. I'm going to go ahead and start with the questions if you're fine with that.
Sure.
How common is it now for oral surgeons to not have anesthesia training and have to hire an outside anesthesiologist?
That's not common at all because part of the residency training program, time is allotted for anesthesia training. One of the websites that you need to go to is the aaoms.org. They're gonna have the latest on, the requirements to become an oral surgeon, okay?
Right.
As far as I know, they have not taken away any anesthesia training from us, okay? So every oral surgeon that graduates from an oral surgery program is going to have a certain degree of anesthesia training. Now, with that being said, you don't have to provide anesthesia training. You don't have to provide anesthesia services. In other words, if I graduate and I open up a clinic and let's say I just wanted to hire an anesthesiologist, I have every right to do that. I don't have to provide the anesthesia, okay? And there's a few oral surgeons that actually do that because they have bigger practices. So let's say if they have 4 surgeons in a big building or an ambulatory surgery center, it may be cost effective to actually hire an anesthesiologist to put their patient to sleep while they're doing an operation. Okay? But it's not very common that people just, not use their anesthesia skills to provide the services.
Right, but in a private practice context, it seems sort of cost effective to minimize overhead costs.
Yes, I never seen anyone do it. The only time I've ever seen it done in a private practice like that is when there's a large number of surgeons.
Right.
So I didn't mention this, but most private practices across the United States are probably 1 or 2 surgeons at the most. And then you'll have,
Okay.
have your groups of 4 and 5 surgeons and probably in larger cities, you know what I mean? But most of it is going to be a 1 or 2 man show, and they're going to do their own anesthesia.
Yeah, I agree, because I shadow a oral surgeon, and he doesn't have like anyone else. He does it himself, but he uses a topical anesthesia, I think.
What you've seen him doing was, in one of the slides earlier, I had in parentheses local and general. Every dentist is trained in local, and that's why I didn't talk much about it. But local anesthesia is just, let's say we're taking a wisdom tooth out, you administer the anesthesia locally. The topical that you saw and the injections that go in the mouth, that's the local anesthesia. But when you see it going into the vein, or sometimes even we're oral surgeons, so we mainly do it through either the nose or the veins. Most of the time, 90% of when you see IV sedation, it's going to be through the veins in the arm. Sometimes I go to the foot. Some of us go to the neck. Okay, but most of the time it's going to be through the arm. Okay?
Yeah, that I haven't seen. I've just only seen like topical, locally.
So it wasn't. So that's something that you don't really see a lot. Now, this was an oral surgeon that you had.
Yeah, it's an oral surgeon. He's also a prosthodontist, so he does both.
Okay. Yeah, you really don't see that a lot. You really don't see it a lot. And I would what I would do, I would go to his website. It's so uncommon what you just mentioned. I would go to his website to make sure he's an oral surgeon.
Okay.
Yeah, I'm telling you, because there's some people out there, and that's another, we didn't talk about that much, but so there's a lot of, I hate to say it like this, but there are a lot of wannabe surgeons. You know what I mean? It's like the guy at the mall that has the LeBron James jersey and the shorts on. The LeBron James shoes on.
My God.
And he probably plays a little bit of basketball, but he's not LeBron James. You've seen that guy. You've seen that guy.
Everyone's seen that guy.
And he's like, the big shot at the mall, but he's really like, okay, who's this clown? I would just double check his credentials. It's very rare that you see an oral surgeon that does not use the anesthesia training. That's literally like throwing money out the window.
Yeah, I'll definitely ask him about it.
Yeah, go to his website. You don't even need to ask him. Go to his website. It should, because if it's an oral surgeon, if it's an oral surgeon, you're gonna go to his website, and one of the first things you're gonna see is, "I'm an oral surgeon." They're not gonna play it off. I'm telling you, they're not gonna play it off. But that's a good observation, though. But we typically do all 3. Topical, local anesthesia, general anesthesia.
Thank you.
All right, next question.
A doctor presenting at ASDA today was talking about using blood plasma and extraction sites as a membrane. Can you talk more about that?
Yeah, you can use, so when you put bone in the socket of a tooth, let's say you take the tooth out, you put some bone in it, okay? So that bone, the idea of the bone is called bone preservation. The whole idea of that is to have bone heal up in the hole where the tooth is at. So there are different types of membranes you could use there. I use pericardial membranes. I use, in other words, the membrane that's around the heart, the tissue that's around, the connective tissue around the heart. On deceased patients, on deceased people, I actually buy that and use that to cover up the holes in the mouth when I put bone in there. You can use platelets, you can use all type of blood products. Some people use collagen. It's really your preference. When you do your training, you learn all these different techniques. What you like and what you're comfortable with, that's what you use.
What you're most comfortable with?
I use collar tape. I use the pericardial membranes, and I use this thing called a collagen plug, depending on the size of the hole and the defect. Because when you take a tooth out, it's going to be different on everybody. Okay, some people are going to have a hole that's this big. Some people are going to have no bone on the outside. So there are different classes of defects, and that's how you're going to do the reconstruction. So depending on the defect, those are the things that I use.
So depending on the case, you're saying?
Yeah, depending on the case.
Thank you.
In other words, it's not like think about your shoes. When you go to a pool party, you wear flip-flops. If you're out in the snow, you wear boots. It just depends on the situation.
Thank you. So why did you decide to go into oral maxillofacial surgery?
So what I loved about it, the reason I went to oral surgery, because I did really good in chemistry in college. And I always liked medicines, drugs, things like that. So my first inclination was, oh man, I'm gonna do anesthesiology. So I'll be an anesthesiologist. I like meds. This organic stuff is for the geeks, but I'm doing okay in it. Then I met the nurse, one of the infirmary at the college I went to. Her husband's a dentist, so she was like, before you decide to do anesthesiology all the way, why don't you go shadow my husband? So you just get an idea of different types of professions, So I went to shadow him, and I wasn't crazy about it. I thought dentistry was cool, but her husband was kind of like this nervous wreck type of guy. Like he was nervous about everything. And I was like, man, this is a weird dude. He's like nervous all the time. But he gave me a great piece of advice. He said, you know what? Because I had told him, that I like medicine and I like the drugs and things like that. He said, you know what? It'd really be cool if you went to go shadow an oral surgeon. And that's the first time I had really heard of an oral surgeon. So I said, an oral surgeon? I said, why? He said, man, because those guys, they do medicine, surgery, and anesthesia. I said, what? I was kind of like, what?
It married your three interests together.
Yeah, together.
I went home and I'm on the internet like crazy. I'm like reading about these guys. I'm like, wow. So I immediately that night, I was so pumped up that night. I stayed up till about 1 or 2 in the morning, and I wrote 3 letters to 3 oral surgeons that were kind of like close by in the neighborhood, not in the neighborhood, but like in the city where I was going to school at. And I wrote 3 of them, and one of them, I put my number inside of each letter, and one of them called me like 2 days later. He's like, hey man, I got your letter. I thought it was pretty cool that you're interested in oral surgery. Why don't you come to my office and come shadow me? So we set it up. I went there like a week later, and within I think I shadowed him. It's been a while, but it was like Wednesday, Thursday, and a Friday. I got really lucky. I happened to be on like a spring break or something like that where I was really free. And Wednesday, Thursday, Friday. By Friday, I had so much information from him. I was like, yo, there's no way in the world I'm not doing this. So then, I went back home and I looked up, online of what I had to do to become an oral surgeon. I was like, well, I'm a few years away, but I'm gonna do it. and that was it. I never looked back, man. I fell in love with it those 3 days, and I just.
You knew straight away.
Man,
this is what I want to do. Yep,
anesthesiology is cool. Anesthesiology is cool. We do a lot of anesthesia, and that's the other reason why I ultimately chose it too. Because I was like, well, as an oral surgeon, I actually can do anesthesia too. So I do a lot of anesthesia in the office. So that's the reason I chose it. I just fell in love with it.
So for those students and attendees that may be interested in pursuing OMFS, in your opinion, what are some important considerations to take into account before choosing a dental school?
That's a good question. I would make sure there's some dental schools that actually don't have oral surgery residency programs. Okay. I would go to a dental school that has an oral surgery residency program.
Okay.
That's very helpful. when I went to dental school to become an oral surgeon. So what I was doing was any time that I had to myself or extra, I would shoot on over there to the oral surgery program. I would shoot over there to their clinic. You can assist, you can ask questions. There's always going to be, remember, it's a group of residents. These are resident doctors, they're training. There's always going to be a few doctors that are willing to help you. They get excited for you, so to speak. They give you they teach you little things. So if you decide to become an oral surgeon, go to a dental school that has an oral surgery program. You don't have to wait till you get into an oral surgery residency to start learning oral surgery. And that's
right. You'll indirectly have access to that additional exposure as a dental student.
Exactly. You're going to be a student there, so you'll be hands-on. I mean, depending on how the school is set up. I went to LSU where I actually went up to the oral surgery clinic, and I would also go to the hospital, and I would assist on mandible fractures. A resident would fix one side of the mandible, and I'd fix the other as a student. Now I didn't get much credit for that as far as school, but the credit is your experience. Your experiences are vital, so that helped me so much because when I went to residency program, I knew a lot of basic stuff. You know what I mean? Right. So if you start at a little bit of a higher level in the residency program, that leaves you more room to learn some other stuff, more advanced stuff, So that's what happened to me. So you want to look at that. Obviously you want to look at the cost of the school as well. I mean, I know dental education has skyrocketed in the last few years. That sucks. But you got to try to balance everything out. I think, did I answer the question?
Yeah, absolutely.
Actually, was it hard for you to balance being a dental student and also going to assist in the clinic at the same time?
No. Dental student takes first priority. So you want to do good in dental school, because if you don't do good in dental school, you're not going to get an oral surgery program. So it's extra. Keep in mind that's extra, okay? No, and the other thing too is that keep in mind that dental school is 4 years. So it's like the first year in dental school, I didn't really go to the oral surgery clinic. Besides maybe meeting the guys, saying hi and bye and, showing them. If you even go up there to talk to them or just ask them some basic questions, they already know you're kind of interested. You don't need to, try to go up there and dive into a surgery. But as time progresses in dental school, you learn more dentistry, but at the same time, you have more responsibility and you have more time to yourself too. You learn how to manage time a little bit better. Your third year, you should be managing time a lot better than your first year. The first year, they're just gonna throw all the basic science at you, and you gotta learn so much. But as the years progress, you have more time to yourself, and that's that free time that I say go and spend time with the oral surgeons, okay? And you'll learn some things. But you don't never want to be in a situation where you're not doing your basic dental work because you want to go hang out in the oral surgery clinic. No, that's counterproductive because like I said, to get in the oral surgery program, you got to do good in dental school.
You got to do good in dental school, exactly. So how hard is it, as an oral surgeon, to network and, get referrals from other clinics around you to get patients over to you?
It's not really hard. It's not really hard, okay? It depends on how aggressive you want to network and get referrals, I wouldn't say I'm very aggressive on that end. There's certain things that I do that help me a lot. The first and foremost thing that I do is I do good oral surgery. When the patient is in the chair, that's your chance to perform. That's your full court. That's your slam dunk contest. That's the chance that you have to show the dental community how good of a surgeon you are. So if you do that one by one, every patient that comes in your clinic, do good oral surgery to form, be the word I'm looking for is be empathetic, understand that the patient in the chair is scared. Understand that the patient that's sitting in that chair just paid you like thousands of dollars. They're scared, they paid you money, they're coming to see you, they could have seen 2 or 3 other people. So that's your chance to do really, really good oral surgery. That patient is going to leave your office or your clinic or the school where you work at or wherever you're at, and they're going to run back and tell their dentist or their physician or whoever sent them to you that you took really, really good care of them.
Right. So your character and your competency essentially serves as your market force.
Exactly.
Self-advertisement.
That's marketing you could do.
Right.
I mean, you can do all these little, you can have the nice fancy website. I don't know if you guys been to my website. It's cordovorosurgery.com. It's a nice website, but I know people that can put a website that make it look like, it's the top website in the world. But at the end of the day, if you don't take care of who's in the chair, they're going to be like, well, he was okay. You don't want them to go back and say, well, he was okay. You want to go back and say, this guy's phenomenal. He was great. If I ever had to go, have something done, I'm going back to that guy. So that's the key to it right there. Okay. So it's not hard to, all the networking. So it depends, like I said, it depends on how aggressive you want to be. Give you another example of that real quickly is, today I did 7 procedures in my office. I made X amount of dollars. Let's just say I made $10,000 at work today. After I pay my staff and I pay my bills and everything, my profit may be $6,000. Well, I can take that $6,000 and invest it all in marketing if I want to on Monday morning, Or I can take that money and put some of it in savings, or I can pay bills or do whatever I want with the money. Okay, I work for it and I've earned it. But depending on how aggressive you want to be, if you really want to be like ultra aggressive, you can take that money and go market, make flyers, put it all over the town. I'm Dr. Such and Such, I'm an oral surgeon, I do this and that. So that question really is on you, Now, it does come in, a few things that will come into play is obviously depending on where you practice. If you're practicing, let's say in New York City, and there are 10 oral surgeons on the same street as you may have to be a little bit more aggressive marketing. You know what I mean? But it really depends. Yeah, you make town and be the only oral surgeon in that town. Probably not have to market as much. Just take care of the patients, and they're going to tell everybody on the street how good you are, and they're going to come to see you one day when they need an oral surgeon.
Was geographical distribution an important consideration for you?
Yes, for me, yes. I wanted to live in the South. I'm from New York, actually.
Okay.
But I was raised there. I didn't have no choice. My parents lived there, and that's where they raised me. But so as an adult, I said to myself, okay, I could go anywhere from California to New York to Texas to Tennessee. I trained in Tennessee, and we liked it here. We kind of liked it's a little slower pace. And it's kind of like in the middle of the country. So if we want to travel and do things like that, it was relatively easy for me. The other thing I looked at it's not really extremely high cost of living. And there are oral surgeons in the city where I live at, but I don't have an overabundance. I didn't feel like there was an overabundance of competition here for me. So I liked it. I wanted to be close to family, but I didn't necessarily want to live in the same town with my whole family.
Right.
So geographically, yeah, it was very, we like where we're at. Some people go places just because of the job. I don't think you should do that. I actually had when I first came out, I had a higher paying offer in St. Louis, but I plain and simply don't like snow. So I didn't go just because I don't want to be in 2 feet of snow. I just didn't want to do that, so where I'm at, we do have, but it doesn't really snow a lot here in the Memphis area.
Right.
So yeah, you want to, when you get out of training, you kind of have to balance that out. Many people that have a spouse or somebody serious, and usually that's a discussion that usually takes place, a year or two before you finish. Some people know where they're going when you start the program, but usually a year or two before you finish, that's when you start really looking like, okay, where am I going to live? Where am I going to practice? And you got to look at everything. You got to look at everything from income to taxes to properties to competition to all type of things like that. You really got to look at.
Right. A lot of variables involved. Isa, just in the interest of time, I think we can touch on one more question before concluding today's presentation.
Let's see. As an oral surgeon, what is the most important thing you stand by as a dentist or surgeon? And what's the most important thing that you say that you do every day?
I'm sorry, actually, one more time.
As an oral surgeon, what is the most important thing that you stand by as a dentist? What's the most important thing that you do every day?
Well, the most important thing is safety. Okay. We do general anesthesia. And so you have to be safe. You have to be very, very competent in the medications that you're administering to these patients. Medical history, medical workup, physical exam, administering the medications, and then doing safe surgery. You have to do that every day because we basically are trained to do outpatient surgery on what we call ASA 1 and 2 patients, some 3s. ASA 3 and 4 is strictly hospital. Remember, you're a patient. If you do everything safely and patients start to die under your care, you won't have a license very long after that, because that's what competency is all about. Okay.
Right.
And the other thing is you take an oath. You're going to take an oath one day when you get a license to do no harm. So you can't hurt people. There's a lot of trust. The public puts a lot of trust in your hands when they give you these licenses and these certificates. I mean, literally every day people's lives are in my hands. When I put them to sleep, I have monitors on them. If I give them too much medication, they can stop breathing. If they have a heart attack, I have to know what to do. Hospital is 15 minutes away, 10 minutes away. If they have a stroke, if they have an embolism, if they have a seizure, you have to be trained very well and understand this. And your whole team does too. So you got to train the people that are, your assistants, your surgical assistants. Everyone has to be trained in case of emergency,
Right.
And those are the most important things of it. You can't hurt nobody,
For sure.
But that's the most bottom line, that trumps income, that trumps geography, everything. You just got to be a very safe practitioner.
Absolutely. Amazing. Well, thank you so much, Dr. Zambrano, for sharing with us a wealth of insight. We want to thank everyone for tuning in today, and we wish you a productive year.
Thank you very much. I hope you guys enjoyed it. And my email's been on every slide. Hopefully some people have picked it up. If they need to, they need to email me any questions or need information, I can send them the links again to the different sites or what have you. And good luck, guys, in school. And hopefully a few of you guys become oral surgeons.
Absolutely.
Sure.
And just to reiterate, we definitely encourage our viewers to reach out. So thank you again.
Thank you so much.
Reach out to me.
Absolutely.